Identify the side of the given bone. It is left-sided scapula. Describe its anatomical position. The scapula is kept on the back of the thorax in such a way that glenoid cavity looks laterally forwards and slightly upwards. Coracoid process is directed forwards. This is left-sided scapula. Identify the colored fossa. The upper colored portion is supraspinatus fossa. The lower colored portion is infraspinatus fossa, and the other one is subscapular fossa. Name the attachments. In the supraspinatus fossa, the muscle attached is supraspinatus, and at the infraspinatus fossa, it is infraspinatus muscle, and at the back, it is subscapularis muscle.
This is a right-sided scapula. Mention the attachment on the dorsal and ventral surface of medial border.
The attachments on the dorsal surface are levator scapulae on the top, and next rhomboid minor, and next rhomboid major. The attachments on the ventral side are serratus anterior. This is right-sided scapula. Name the attachments on the lateral border. The attachments are latissimus dorsi, teres major, teres minor, and at the infraglenoid tubercle, the long head of triceps, and at the supraglenoid tubercle, long head of biceps. This is left-sided scapula. Identify the colored part of the bone. The colored part of the bone is supraglenoid tubercle, and this is infraglenoid tubercle. At the supraglenoid tubercle, the attachment is long head of biceps, and at the infraglenoid tubercle, it is long head of triceps.
This is right-sided scapula. Name and identify the processes of scapula. The pink color process of the scapula is spine of the scapula. The green colored is acromion process, and the yellow colored one is coracoid process.
Name the attachments on the colored. This is a right-sided scapula. Attachments on the colored area. On the blue part, the attachment is pectoralis minor, and on pink part, it is coracobrachialis and short head of biceps brachii.
Identify the process and mention the type of epiphysis. It is the coracoid process, and the type of epiphysis is atavistic epiphysis. This is a left-sided scapula. Identify the colored part of the scapula. The blue colored portion is the upper lip of the spine of the scapula, and the pink portion is the lower lip of the spine of the scapula. Mention its attachments. The attachment on the upper lip of the spine of the scapula is trapezius muscle, and on the lower lip it is the deltoid muscle. Identify the colored notches. This is the suprascapular notch, and this is the spinoglenoid notch. Name the structures passing through the foramen. The spinoglenoid notch is meant for the passage of suprascapular nerve and vessels, and this is meant for the passage of suprascapular nerve. This is a left-sided scapula. Name the joints formed by scapula. The joint formed here is the shoulder joint, and the joint formed here is acromioclavicular joint. The shoulder joint is ball and socket joint, and the acromioclavicular joint is gliding synovial joint. This is a left-sided scapula. Mention the movements of the scapula.
Movements of the scapula are protraction, retraction, elevation, depression, medial rotation, lateral rotation. Name the muscles causing the movements of the scapula. For protraction, the serratus anterior and pectoralis minor. For retraction, the middle fibers of the trapezius and both the rhomboides muscles. For elevation, the upper fibers of the trapezius and levator scapula. For depression, pectoralis minor, latissimus dorsi, and the lower fibers of trapezius. For medial rotation, levator scapulae and both the rhomboides muscles. And for lateral rotation, upper and lower fibers of trapezius and serratus anterior, the last 5 digitations.
Describe the ossification of scapula. The scapula ossifies from one primary center and 7 secondary center. Primary center. One center appears in the body during 8th week of intrauterine life. Secondary centers. First secondary centers appears in the middle of coracoid process during first year. The following 6 centers appear at puberty. 1 for root of coracoid process, 2 for acromion process, 1 for medial border, 1 for inferior angle, 1 for lower 2/3 of rim of glenoid cavity. Fusion. Subcoracoid center fuses with rest of the bone by 15th year. All other centers fuse by 20th year.
Applied aspects related to scapula.
Winging of scapula. Paralysis of serratus anterior causes winging of scapula. In case of paralysis of serratus anterior, the patient is unable to raise the arm above the head as the paralyzed muscle can no more rotate the scapula. Scaphoid scapula. It is a developmental defect leading to the formation of scapula with concave medial border.